And right now joining us by phone to help sort out what this aid package may mean for us here at the county level is County Board of Supervisor Nathan Fletcher. Worth noting too, he was planning to be here in person, but Nathan, out of an abundance of caution, we are now talking to you by phone instead this morning. So we appreciate you being here. And we want to talk about that declaration of a national emergency, how the House bill that was passed now to come before the Senate, how it will impact us here locally.
Thank you. Well, the hope is that it can provide needed funding. I think one of the most important things that we can do right now is ensure, in particular, workers who are impacted by this are able to continue to pay their bills and able to continue to put food on the table, and able to continue to take care of their families. And so I would worry, on a daily basis at the county about the public health impacts, about how do we flatten the curve, how do we slow the spread, how do we deploy more testing? How do we make sure the homeless are taken care of in congregate care settings? But I think that the federal aid package can hopefully provide a real boost into the economy because there's a lot of folks that are struggling right now. If you're a maid or a worker in one of our hotels that's been impacted, you could be out of work. If you're a small business owner, if you run one of the many facilities that have been shut down, and so I think that's where there's the most opportunity.
And Supervisor, you just touched on deploying more testing, and that's one of the questions we want to ask you. We've seen people across the country that have been turned away. They've had problems with availability. Do we have enough tests here in San Diego County?
No, we do not. No one has enough testing. The simple reality is, I think in large part, CDC was perhaps caught flat-footed, but there hasn't been enough testing. And at the County of San Diego, we are doing everything we can to get more testing into our region. We're pushing the state. We're pushing the feds. We're working with our hospitals to help facilitate them getting their own testing. We're looking for what's commercially available, and we want to get more testing, and we are hopeful that every day it appears to be like the supply chain issues and the general supply of testing is going to increase. But until such time as we have enough tests, we really do have to prioritize those. If you have a senior citizen with an underlying health condition who lives in a congregate care setting, they live with 200 other folks and they're showing symptoms, that person has to get tested first. If someone is an emergency room doctor who came in contact with someone who has tested positive for coronavirus, that doctor has to get tested first, because if they're negative, they can go back to saving people's lives. And so we are pushing to get as much testing capacity as we can. And until then, there has to be a prioritization of what is available.
And Nathan, before we let you go, we just have a few more seconds, but in the months ahead, there's going to be a lot of discussion about how the county planned for this outbreak, what the county got right and what the county got wrong. So can you bottom line for us, are we ready?
Well, I think the county, was interesting in January when we made our first announcements about all the steps and actions we were taking. I was met with tremendous criticism that you're scaring people, you're alarmist, this isn't going to be a thing, there's no reason to worry. In February, more than a month ago, when we were one of the first agencies, the first entities in the entire state of California to declare a public health emergency and a local health emergency, we got the same thing. But the reality is we saw this as a thing to be of concern. And we felt like everything that we do would have the opportunity to flatten the curve, which is why we put in place a dedicated plan focused on the homeless, dedicated engagement with our hospital systems to get the equipment they need, standing up our emergency operations center, being very transparent with what we're doing in testing, daily interaction with CDC, with the military, with everything. And then the situation in San Diego has been further complicated, and we're one of the jurisdictions in the country that has received the most outside patients. We started with all the folks that were repatriated from China right here in the Miramar. And to date, we've taken almost 500 individuals from the Princess Cruise Line. And so every day since January, we've been working and focused to try and tackle this issue. And I'm very proud of the work that the county has done. Unlike maybe in the past, you have the county and the cities working together, speaking with one voice. Our state leaders have been very helpful and supportive. And so there's nothing in a global pandemic that any jurisdiction can do to avoid any of their folks getting it or avoid the spread. And there's always lessons that can be learned. But I think the people of San Diego should be pleased with all of their elected leaderships in this crisis coming together and working hard to try and protect them.
Supervisor Nathan Fletcher, thank you for being with us this morning. As he mentioned, the county does not have enough tests at this time, and they do have a plan in place, and hopefully we'll get more of those, and they need to prioritize the testing to the people who need them, as he mentioned. So thank you for being with us this morning as we continue to follow this developing story.